Okay, so good day. I'm Dr. Charmaine Rabago from the Health Facilities and Services Regulatory Bureau of the Department of Health. Today, I'll be discussing one of the control knobs of health system, which is the health regulation. Okay, so to start with, one of the goals of RA 11223, also known as the UHC Act, is to ensure that all Filipinos are guaranteed equitable access to quality and affordable healthcare goods and services and protected against financial risk. This is the reason why all the recent strategies of the government are directed toward ensuring access to comprehensive healthcare goods and services. It includes preventive, curative, rehabilitative, and palliative health services. Ensuring access means that Filipinos can easily avail healthcare services and goods. And availability means that people were able to access these services when they need it and where they need it. Unfortunately, we've been hearing news about surgeries that went wrong, clinical laboratories that have not fully validated their results, rampant selling of counterfeit drugs, complaints or alleged malpractice of physicians, and hospitals that refuse to provide emergency care for patients who cannot provide deposit payment. These are examples of potential dangers of unconstrained or uncontrolled entrepreneurialism. So how does the government protect its citizens from these dangers? And how do we ensure the safety and quality of healthcare goods and services? Most governments choose to adopt a strong regulatory regime as response to this issue. In this lecture, we aim to understand the concept of regulation in health sector by answering the following questions. What is regulation? Why do we regulate? How does regulations affect the performance of health systems? What are the major determinants of regulatory success? And what are the major types of regulation in health sector? So we begin with what is regulation? Regulation refers to the government's use of its coercive power to impose constraints on organizations and individuals. When we say coercive, that means that it's mandatory. So the government sets standards and requirements, and the firms, the businesses, both private and government, are required to abide and comply with all these structured and prescriptive standards. So it includes laws, decrees, orders, codes, administrative orders, rules, and guidelines. Another definition was provided by the OECD, and this definition highlighted the use of penalties or sanctions. So in instance that the health facility or the health service or goods are not compliant with the set requirements, then the government may impose penalties or sanctions. So this is very characteristic of the regulation or regulatory approach. This is just to show the range of different policy instruments that governments use to achieve the desired policy outcomes. So you can see here the level of state involvement from lowest to highest. The lowest would be the use of market, and then the highest is the direct provision of health services and goods by the government. Voluntary instruments include market, voluntary organization, and information, while compulsory instruments include tax and user charges, regulation, public enterprise, and direct provision. In between these two instruments are the mixed instruments, which include exhortation and subsidy. So you can see from this range that regulation has a high level of government or state involvement. Okay, so currently, the health regulation in the Philippines basically utilizes the command and control approach. This approach means that the regulatory policies utilizes standard setting, prohibition, permission, and enforcement. So a national law gives a government office the authority to impose regulation on certain services, products or commodities, and even professional practice. Then the regulatory policy provides guidelines on the licensing or accreditation standards and requirements. These standards are anchored on the principles of safety and quality. There are three types of regulation: economic regulation, social regulation, and environmental regulation. So the economic regulation refers to control of prices and volume of production or return of investment or entry into and exit from an industry. An example of economic regulation is the Drugs and Medicines Price Regulation, also known as the Cheaper Medicines Act. So it was stated under this law that the government shall adopt appropriate measures to promote and ensure access to affordable quality drugs and medicines for all. So in the event that the full competition is not effective, the government may regulate the prices of drugs and medicines. Also, during the time of COVID-19 pandemic, a joint regulation of prices by the Department of Trade and Industry and the Department of Health for the COVID-19 RT-PCR testing kits and rapid antigen testing kits were issued. Okay, for social regulation, these are controls in matters of health, safety, social practices, physical and moral well-being. Examples of which are mandating consumer product safety information labels. Ito yung mga nakikita natin sa mga packs ng cigarettes. Requiring new cars to be equipped with airbags and seatbelts, and assignment of smoking and non-smoking areas. So it also influences the behavior of people. Okay, for the environmental regulation, it's actually a hybrid between economic and social regulation. Social regulation. So there have been unprecedented efforts to reduce global emissions of chemicals and pursue environmental-oriented thinking through the issuance of environmental regulations. So this includes the Ecological Solid Waste Management Act of 2000, the Philippine Clean Water Act of 2004, and the Toxic Substance and Hazardous Nuclear Waste Control of 1990. So why do governments regulate? There are three reasons. First, to ensure honest and open market exchanges. Second, to promote equitable access. Third, to correct market failures. So for the first reason, which is to ensure honest and open market exchanges, governments do this by establishing the obligations of consumers or patients and service providers, such as doctors, pharmacies, and hospitals. So there is a legal and regulatory framework to establish the basic conditions for market exchange. For the second reason, which is to promote equitable access, if we're going to rely only on market principles, poor patients would not be able to access healthcare services because of their limited capacity to pay. There are also geographical and economic barriers to consider. In addition, few healthcare professionals such as doctors and nurses would choose to serve in rural areas due to limited economic opportunities that these areas offer. Regulation can be used by governments to ensure that health services can still be equitably distributed. Example of regulations regarding this is the Administrative Order number 2021-0029, which is the guidelines on the prioritization of processing of applications of DOH authorizations of health facilities located in the geographically isolated and disadvantaged areas in the Philippines. So it actually improves the ease of doing business with establishment and licensing of health facilities located in GDAs in the country. So if there's ease in establishing health facilities, then of course there would be improved access to healthcare, especially in these areas. So this is just to show the general guidelines of that policy, and I just like to highlight, the key features such as the establishment of priority lane for applicants from GDAS, the waiving of certificate of need, because previously that's a requirement for establishing hospitals. And then there's also the compliance with the Ease of Doing Business Act. Okay, the third reason is to correct market failures. The government must protect consumers from market failures, which can potentially endanger their safety. For example, consumers may be unable to detect the quality of goods or services they consume. So that is an example of information asymmetry. Similarly, information problem is caused by incorrect decisions of people due to lack of access or blatant disregard for important information. So we had those issues also during the COVID-19 pandemic when we were trying to disseminate the information on COVID-19 vaccines. The objective of vaccinations against COVID-19 is to protect people against the virus and lower the chance of one person infecting others. However, there was a significant percentage of population that did not fully understand and accept the vaccine, which initially resulted in the lower utilization or acceptance of the vaccine. And this results in market failure. Another example of market failure is when the government needs to respond to monopoly in which competition does not force producers to lower down costs. So if there's monopoly, that would result in increased cost of services and goods. Examples of these are monopoly of OFW clinics, oversupply of demerit goods, and lack of public goods. Okay, so one regulation or regulatory policy related to that is the issuance, or to correct that problem on market failures, is the issuance of the guidelines in the public access to price information of all health services and goods in health facilities in the Philippines. So to empower the public in making informed decisions when choosing for healthcare providers and health products, thereby promoting fair pricing, a mechanism for monitoring price transparency was established. So this was the guidelines. So the objective of this policy is to ensure that the price list of all health services and goods being offered in hospitals and other health facilities such as clinics, dialysis facilities, birthing homes are accessible and available to the public. Also, according to these guidelines, the health facilities shall ensure that the updated price lists are readily accessible. And the price list has itemized comprehensively all its fees, indicating even the outsourced services. And there should be complete transparency of all prices and fees, and there should be no hidden charges. So the DOH and the regional counterpart offices are monitoring the health facilities to ensure compliance with this requirement or with these guidelines. So this should be included in the price list, the price per type of accommodation, the medical and surgical procedure fees, the laboratory test fees, the diagnostic and imaging test fees, drugs and medicines, supplies fees, service packages, the PhilHealth package rates, and the HMO rates. Okay, another regulatory policy that would like to address the issues on market failures is the DOH Health Facility Price Advisory online system. So the goals are to ease and standardize the posting of prices by the health facilities, to simplify monitoring of prices by the Department of Health and PhilHealth, to make price information more accessible to the public, and lastly, to provide other benefits to the public, such as information on the location of the hospitals, hospital emergency hotlines, and search engine for hospitals offering a specific service. Okay, as was already mentioned earlier, one example also of trying to regulate the prices was the joint policy by the DTI and the DOH. Okay, wherein the both agencies set the price range for the COVID-19 testing kits, including the rapid antigen tests, to ensure quality of service, affordability, and availability of these kits to patients and other consumers. Okay, now another reason for regulation is that the governments regulate in order to promote moral norms, no? Depending on the values and moral sensibilities of a country, certain services or procedures can be regulated, such as blood transfusions, organ transplantation, abortion, euthanasia, dangerous drugs, alcohol, tobacco, and use of seatbelts and helmets. Okay, so how does regulation influences the performance of health system? First, we briefly describe the health system. So this is to show the WHO health system framework. It shows how the system building blocks, the service delivery, health workforce, information, medical products, vaccines and technologies, financing, leadership, and governance work together to attain the health system goals, which are improved health, responsiveness, social and financial risk protection, and improved efficiency. However, to attain these overall goals, the health system must first be able to ensure access to safe and quality health services and increase the coverage of population that benefits from them. With the new administration, the Department of Health issued its medium-term strategy for health sector 2023 to 2028, and we call it the DOH 8-point agenda. The vision of the health sector is that Filipinos are among the healthiest people in Asia by 2040. It also follows the WHO health system framework, in which we have our 8 key strategies grouped into 3 major categories: the bawat Pilipino, bawat komunidad, and bawat health worker at institusyon. And all these 8 action agenda items work together to achieve the 3 desired impacts: better health outcomes, stronger health systems, and access to all levels of care. The goal of health regulation is anchored on the second action agenda, which is ligtas, de kalidad, at mapagkalingang serbisyo, or safe, high quality, and people-centered services. It involved not only guaranteeing access to affordable essential medicines and treatments, but also prioritizing holistic care. So as you can see, the regulations contribute to the achievement of the health sector goals by ensuring that the inputs to the system, the health workers, health facilities, medicines, and technology are available. Now, what are the major determinants of regulatory success? We actually have 4: cultural attitudes, capacity of the government, political support, and the design of regulatory institution and processes. So there are 2 kinds of cultural attitudes that are critical to regulatory success: general and specific. When we say general, it refers to the views of the citizens toward the government, and it varies widely among different countries. So if the citizens highly trust the competence and legitimacy of actions of the government, the more likely they will comply with regulations. If not, people tend to look for ways to avoid complying with regulations. On the other hand, it is also critical to consider the cultural and social beliefs of people. For example, in some countries, efforts to regulate alcohol use have failed because they are simply not consistent with cultural beliefs. And because of that, other policy instruments such as social marketing and health advocacies should be implemented alongside regulation. The second determinant is the capacity of the government. Regulations require heavy administrative and technical expertise. So in the case of expanding health facilities and services in the country, regulatory agencies also need to strengthen their capacity to cope with the demand and to be always updated with the latest in medical technologies. Third, political support is important in instituting regulatory process and effective implementation. There must also be continuing political support to prevent regulatory capture. That is, when the regulators try to influence regulatory policy decisions that are only beneficial to them. And lastly, the outcome of the regulatory initiative depends on the design of the regulatory institutions and processes. It depends largely on the enforcement process, the ability of the regulators to monitor, detect, and penalize violations. However, most regulatory agencies have limited resources for monitoring. That's why it's important that regulatory offices find ways to carry out these tasks cost effectively. What are the major types of regulation in health sector? So different national agencies were mandated by law to enforce regulatory power over these services and commodities. The regulation of health facilities and services is under the Department of Health. For the pharmaceuticals and medical devices, that's under the Food and Drug Administration. And the regulation of medical professionals is a function of the Professional Regulation Commission. Now, to illustrate how health services are being regulated in a hospital, the Republic Act 4226, also known as the Hospital Licensure Act, was issued in 1965, and it actually mandates the Department of Health to regulate all hospitals in the Philippines. And under this law, it actually sets the minimum licensing standards for hospitals that are classified into service delivery, personnel, the physical plant or the infrastructure, equipment and instruments, information management, quality improvement activities, and environmental management. So those are the major areas that we look into when issuing license to operate to hospitals. So as we've already mentioned, the regulatory approach currently in the Philippines is command and control. So there's a prescriptive set of standards and requirements that the health facilities must adhere to. Same with regulations for medical devices and even for drugs. Okay, so to give you an idea on how hospitals are being regulated in the Philippines. So we start with the service capability. Definitely, we must ensure that the hospital is capable of providing the right level of clinical care to the patients. Okay, so a hospital shall ensure that the services delivered to patients comply with the standard quality in the assessment tool, or this is like the inspection checklist used by regulatory officers during inspection and monitoring. So, according to the law or the Hospital Licensure Act, a hospital shall provide services for all kinds of diseases, injuries, or deformities. And it shall include clinical services for inpatients and have consulting specialists in medicine, pediatrics, OB-GYN, and surgery. It must also have emergency and outpatient services, isolation facilities, surgical and maternity facilities, clinical laboratory, blood service facility, X-ray facility, dental services, pharmacy, and ambulance services. Now, for the X-ray facility and the pharmacy inside the hospital, the Food and Drug Authority issues the certificate of compliance. And for the use of radioactive materials in the hospital, the Philippine Nuclear Research Institute issues the appropriate license or authority. Okay, for personnel, a hospital must have adequate number of qualified, trained, and competent staff. So the medical, allied medical, and nursing staff should be TRC licensed and appropriately trained in accordance with the personal qualifications required by DOH. So there's also another regulatory body or agency that is involved in checking for the qualifications and credentials of health personnel in the hospital. Okay, next. For the physical plant or the infrastructure, a hospital shall have physical facilities with adequate areas to safely, effectively, and efficiently provide health services to patients. And aside from the licensing requirements of DOH when it comes to establishment or building hospitals, the facility must also comply with the requirements of building code and fire code. Okay. For the equipment and instruments, they're actually inspected if they are available, operational, and consistent with the services. A hospital shall be adequately equipped based on the level and complexity of healthcare services it provides. There shall be a program for calibration, preventive maintenance, and repair of equipment. Now, for medical devices that require certificates or authorizations, they get it from or they secure it from the Food and Drug Administration, like x-rays or some other medical devices. Okay, for the information management, every health facilities should maintain a system of communication, recording, and reporting, releasing of patients' results in adherence to the Data Privacy Act and the mandatory reporting of notifiable diseases and health events of public health concern. Also, for licensing, hospitals shall establish and maintain a system for continuous quality improvement activities. So there must be a quality assurance program and proof of continuous quality improvement. Lastly, a hospital shall ensure that the environment is safe for its patients and staff, including members of the public, as necessary. It shall be well ventilated, lighted, clean, and safe, and there shall be a program of proper maintenance and monitoring of physical facilities. Even the water supply for all purposes is inspected and monitored by the Department of Health and the local government unit, and safe and potable water should be available at all times, so they check that. A system for proper solid waste management shall be established and should be in accordance with the Department of Health Manual on Healthcare Waste Management and Environmental Management Bureau and DENR environmental laws. Okay. Now, the gaps in the health system became more pronounced during the COVID-19 pandemic. So there's an increased demand for capacity of health facilities and emergence of new health facilities and services. And regulation played a big role during this time, during the pandemic, to ensure that there's still provision of safe and quality health services despite the surge of patients in hospitals during that time. Okay, so we're aware, we know that during the COVID-19, there were surges due to the emergence of new variants, and there's a need for hospitals to respond to the increasing demand for COVID-19 dedicated beds. Okay, so the governments to ensure that the government to ensure that patients have access to hospital care during the pandemic, the government intervened by issuing guidelines and mandatory requirements regarding the allocation of beds for COVID-19 patients and for non-COVID-19 patients. Okay, so during the surge response stage, a government and private hospital were required to dedicate 50% and 30% of its beds respectively for COVID-19 response. Furthermore, for level 2 and 3 hospitals, 15% of all COVID-19 dedicated beds were allocated as ICU beds or ICU ready beds. So as discussed earlier, this is a type of response or regulatory response in which we try to improve equity and access to health services. Okay, in addition, diagnostic and therapeutic scope and capacity of the health system expanded during the COVID-19 pandemic, leading to emergence of new types of health facilities and innovations. So there's the emergence of the COVID-19 testing facilities, and then there's also a need for us to set up temporary treatment and monitoring facilities, also the hospital extension facilities, the temporary ICU in level 1 hospitals, and the emergence of digital healthcare solutions. So regulations or the regulatory agency was required to respond to to the emergence of these new types of health facilities and services. So new licensing guidelines were issued to ensure that these facilities provide safe and quality services to the public. Okay, so we've seen that the regulatory pillar strives to ensure that the public is protected from unsafe medical practices, fraud, and unreasonable fees. By ensuring the compliance of all health facilities, services, medical and allied medical professionals, health goods and commodities in the healthcare provider network with the set regulatory policies and standards, we can progressively realize the goals of universal healthcare. The Juans and Juanas of the health system, especially the poor, can truly readily access and use safe and good quality healthcare. So with this, I hope you gained new insights and understanding on how the health regulation works in the Philippine health system. So for further reading, you can refer to these books and references. Okay, so thank you very much.